So the problems, in healthcare are only going to increase because the way we are going, we are headed nowhere. And you've heard of the term NCDs, non-communicable diseases, which are led by diabetes, high blood pressure, cardiac diseases, strokes, cancers, liver, kidney, and obesity, etc. So this scourge has to be controlled, and fortunately or unfortunately, it's so easy to control them only if the government and the people here in our country were slightly more serious about their health. So our job is to make people more responsible for their own health and asking for them to do a blood test. I'm not saying because I'm Dr. Lal and run PathLabs, but a blood test was proved, or a test was proved so mandatory even during the time of pandemic, COVID. So it has to be, you have to start from testing. So this test, which I'm saying is that people, you'd be shocked to hear this Government of India statistics, that 55% of the people in India, they do not know that they have, hypertension, high blood pressure. 48% do not know that they have diabetes. So what more is left? And we can go on, but these are the two main killer diseases. Diabetes or hypertension, or diabetes plus hypertension, etc., etc. And with that, the cardiac diseases you are hearing every day, a 27-year-old IT chap has fallen dead, etc. So how do you want to find that out? It's not good. He's not going to come and tell you that, there's something wrong with me. So you have to catch them in time. You've got to catch them young. So we have to create awareness, and I'm glad Indian Express, the newspaper, has said, it's Indian Express's report that there are 300,000 or 3 lakh labs in India, and only 2,000 of them are accredited by NABH or NABL. So you can imagine what we are talking about. So suffers, what is the problem in India is that accessibility is a problem, affordability is a problem, and quality is the biggest problem. So in our profession, which is healthcare, we cannot afford to say that we are not serious about quality. And just imagine there are 3 lakh labs in India and only 2,000 are accredited. So we need to do something about that. As always, Indian Express is taking the lead, and especially Financial Express. And I would like to say that they should do it more often. I've called Mr. Kumar, whom I've known for a long time, to come and sit with me personally one day, and we can devise something more. Basically, India suffers from lack of awareness. It's only when somebody falls sick that you go there. So Indian Express and Financial Express can help us in a very big way. Thank you.